It is Heart Healthy Month. We know that heart disease is the #1 cause of death for both men and women. Joining us is Dr. Channamsetty to explain that there are multiple tests being offered, and you should really talk to your doctor about which one is right for you. So let's talk about some of the cardiac conditions that Americans are most at risk of getting. And the first one is coronary artery disease.
The three most common are coronary artery disease, CHF, also known as congestive heart failure, and then there's a lot of irregular heart rhythms that can affect patients, the most common of which is AFib.
Exactly. So let's go to the first one, coronary artery disease.
Right. Coronary artery disease is when plaque builds up in the arteries that supply blood to your heart muscle, and this could be very dangerous and it could lead to heart attacks. Symptoms may include chest pain, shortness of breath, decreased exercise tolerance. Sometimes you might get atypical symptoms such as indigestion, and sometimes no symptoms at all.
Women and men differ as well.
Yeah, women are more likely to feel the atypical ones. And fortunately, there's a lot of tests out there that can help us screen for it. Your doctor will check some simple tests such as blood pressure, cholesterol, glucose level, and a simple EKG. There's also some more involved tests. A coronary calcium score can be done even if you don't have symptoms, but you have significant risk factors for coronary artery disease. Or even if you're a man greater than 45 years old or a woman greater than 55 years old, it's a consideration. More involved tests can include stress tests. We've all heard about this, and what a stress test is we subject your heart to physical stress. This could be done by exercise, but if you're unable to exercise, we can use a medication to kind of make it seem like your heart is being stressed out. And then we take some very involved pictures, and this gives us an idea of whether there might be dangerous blockages.
Are these screenings pretty effective?
Yeah, they're overall pretty accurate, but if we remain, it's a good question, because if we remain concerned, none of those tests are 100% accurate. The most accurate test, although it's invasive, is known as a cardiac catheterization. So if we remain concerned, we would perform that. This is a procedure where we go through the wrist or the groin, take a catheter into the heart, and have a look at the arteries. We look for any blockages, and the good news is if there are any significant blockages, we could fix it right then and there with a small device called a stent.
That is a good thing. All right,
Yeah.
Let's move on to CHF.
Yes, CHF stands for congestive heart failure. When the heart muscle weakens or there's a problem with the valves within the heart, what can happen is fluid can back up into the body, including the lungs. This can cause shortness of breath, swelling, or sometimes just a generalized sense of fatigue that's somewhat nonspecific.
What causes that?
What causes that is sometimes as we age or people with hypertension or other conditions, their heart muscles can weaken, or there are also valves within the heart that can become damaged or diseased, and this will cause all the blood to flow the wrong way.
And the screening for this?
Yeah, the test for that is for the most part known as an echocardiogram, and it's fairly simple. What that is, it's a very sophisticated ultrasound study of the heart muscle and structures, and that can give us a real good idea if you might be at risk of developing CHF.
AFib?
AFib,
also very common.
Also very common. AFib stands for atrial fibrillation, and it's an irregular heart rhythm. It's an irregular heart rhythm that could cause you to have palpitations, dizziness, shortness of breath, and sometimes even other symptoms like fatigue and just the sense of not feeling well.
When we talk about irregular heart rhythms, the heart could be slow, it could be fast.
Exactly. You can have slow, irregular heart rhythms, fast, irregular heart rhythms. There's a lot of them, but the most common is AFib. And the other dangerous thing about AFib is you might not even have symptoms, and it puts people at risk of having a stroke, which could be devastating.
Well, who should be screened for this then?
You should talk to your doctor. People with risk factors such as hypertension, age, and possibly coronary disease should be screened for that. And there are multiple screening methods. For the most part, screening methods for AFib are monitors that we place on the body and the patient goes home. These monitors could stay on for days or months. We even have a small little device that we place right underneath the skin if we need longer-term monitoring, and that could be monitoring patients for even years and really make sure that a patient doesn't have AFib. It really should be treated if you have AFib.
The most important thing here is to talk to your doctor.
Yes, talk to your doctor about what screening tests or what tests you should do. And, you know, because basically heart disease, like you said, remains the #1 killer for Americans, and it's very important that we detect these people because early prevention is key. And you know, one of the reasons I became a cardiologist is once we find out, there's a lot we could be doing to help these people.
Absolutely. Dr. Channamsetty, thank you so much. For more information, you can go to stvincents.org/heart.